Drug allergies are not common, but they can trigger severe reactions and make it difficult for someone to receive medical treatment. Penicillin, sulfa drugs, and tetracycline are the antibiotics most likely to cause problems. In fact, penicillin is the most common type of drug allergy, and anaphylactic reactions to it can actually cause 400 deaths a year in the U.S. alone. If you're in need of an antibiotic, work with your doctor to find one that you can tolerate that won't cause an allergic reaction. The pain relievers acetaminophen, codeine, morphine, opium, ibuprofen, and aspirin are also known to trigger allergic reactions, as are anti-seizure medicines such as phenytoin and carbamazepine. In some instances, however, it is the inactive ingredients, such as the dyes or the binders, that trigger the allergy, not the drug itself. An allergic reaction to a drug does not usually occur the first time the drug is taken. That first dose introduces the drug to the body, and at that point, in some people, the immune system overreacts and produces antibodies to the drug. Those antibodies will then set off an allergic reaction the next time the body encounters the substance. Symptoms of an allergic reaction to a drug may include stomach pain, cramps and bloating, hives, itchy eyes, congestion, and swelling in the mouth and throat. More severe drug allergies typically cause difficulty breathing, swelling of the lips, the tongue, the face, waves of dizziness, confusion, increased heart rate, nausea, and diarrhea. These effects often appear within minutes of taking the medication. In some rare cases, an allergic reaction occurs up to a week or more after the drug is taken. To find out if you have a drug allergy, your doctor may conduct skin tests, but skin tests don't always reveal the drug allergy, or they may cause a serious attack themselves. As for treatment for any allergic reactions, antihistamines and corticosteroids can take care of any rash, hives, or any itching. Bronchodilators may be prescribed to widen the airways if congestion and coughing are a real problem. But for more serious reactions, you may have to rely on an EpiPen, which comes in a single dose shot for self-injection, and it's been in the news a lot lately. Whichever type of allergic reaction you're having, what's most important is surviving the reaction, so make sure to consult with your doctor to discuss your individual case. I'm Dr. Corey Hebert with your Weekend House Call.